My name's Kathryn. Good morning, everyone. My name's Kathryn Gretsinger. Wasn't sure whether we were going to be recorded or not. I feel so privileged to be working beside the two panelists that you're about to meet, Alexander Kim and Moira Wyton. This is such a conversation, a topic that is near and dear to my heart as someone who has been covering drugs and drug policy for 3 decades. And the more the conversation changes, the more it stays the same. And to watch the extraordinary work that Moira and Alex and others like them have been doing in recent times is really reassuring, but also such a reminder of the long way we all have to go in properly representing the story of drugs and drug policy in Canada. And with this hideous crisis that continues, and with it largely being invisible to the general public for some mysterious reason, I think it means that it's on all of us to participate in the conversation as fully and as clearly and as actively as we possibly can. So it's really wonderful to be in this space beside two people who I so deeply admire for the work that they're doing and the intentional listening and the connection to people with lived and living experience. That's the way forward. I really believe that. So I'm really glad to be alongside of you two. I want to acknowledge where we are. In my home, I am on the traditional territories of the Musqueam, the Tsleil-Waututh, and the Squamish people. This was a trade route for millennia where people would come and go through this space. It's a place of learning and language and culture that has largely been erased. These are unceded traditional territories that we live on, and just important to be mindful of that as we have these conversations and try to do so in a good way. So I'm going to stop talking now and invite Moira and Alex to introduce themselves. And then we'll just get down to business and talk about some of the ways in which we think journalism and investigative journalism can make the change that might be, or help to make the change that might be necessary. So Moira, I'm going to turn to you.
Hi, Kathryn. Thank you so much for that introduction and prelude. My name is Moira Wyton. I'm the health reporter at the Tyee, which is a BC Vancouver-based online news and culture publication. I'm reaching you today from the traditional territories of the Squamish, the Tsleil-Waututh, and the Musqueam people, and I grew up on Treaty 6 territory, on the traditional territory of the Papas Chase Cree Nation. I cover a lot of drug policy, substance use, mental health, COVID-19, the intersection of all of those. And I'm really looking forward to talking a bit more about, excuse the background noise, my apartment turns into a greenhouse without the door open these days. But I'm really looking forward to talking a little bit more about, even just with my year and a half on the beat, about kind of how journalism is changing to respond to coverage of public health crises and also public health emergencies, and being part of those solutions, as well as relaying what's going on to readers.
Yeah, thanks. Thank you, Kathryn and Moira. I'll add that today I'm calling in from Treaty 7 territory, which is today so-called Calgary, which is the traditional ancestral territory of many different groups of Blackfoot people. Yeah, so I work as a producer for a podcast called Crackdown, which is a podcast based in Vancouver that is about drugs and drug policy and drug user activism. And our show is hosted by Garth Mullins, who is a drug user and a longtime activist in Vancouver and the downtown east side. And we have an editorial board made up of drug user activists from different organizations in the downtown east side. So our organization is really from the perspective of drug user activists and drug users in the downtown east side. That's who we serve, and that's kind of the perspective that we are trying to represent in our show. So yeah, I don't know what else to say about me except that I used to be a student of Kathryn's, and she kind of introduced me to reporting on the downtown east side and how complex and delicate that is. And yeah, I guess that's all I got to say for now.
So I'm starting to see people flip on their screens. I just put a little note in the chat that everyone is welcome to participate, make comments as we go. You know, just like most of life, there's no right or wrong answers in all this. We're all trying to do our best to muddle through. These are complex issues and complex questions we want to be asking ourselves. So if you feel like you want to turn your camera on, you're welcome to. You don't need to do that at all. If you want to just be listening, that's great. But if you want to participate in the dialogue and use the chat or use emojis, whatever you want, we want to be open and have a fluid conversation. I guess I should probably talk for a moment about how I came to be introduced to this whole conversation. I was working as a reporter in Vancouver after spending a couple of years in Alberta, working as an associate producer at the CBC. Came back to Vancouver to work as a writer broadcaster. And it was just at a time when we were starting to acknowledge that there were some people who are living a street-involved life in Canada. We're pretty good at denial in this country. And we certainly were then about who was living on the street and in what ways and what were the precipitating factors. Anyway, there was one particularly harsh winter in Vancouver, which doesn't happen very often for those of you who are attached to this place. And so we decided that part of my role would be to spend a couple of days out. So I did sort of 48 hours out on the street, and I would come into our morning show and tell these stories. And one evening, it was very late. It was around 1 o'clock in the morning. And I was down on Cordova Street at a place called the Crosswalk. And the door was closed and people were sort of huddled inside to try to keep warm. And it was so snowy, very weird for Vancouver. The window was all fuzzed up with body heat and just, it was steamy and weird inside. And then we were knowing that there was this icy experience outside, tons of humans all packed in there together. And I became aware that there was somebody at the window kind of going like this on the window. So nobody seemed to be going and trying to bring the door to open the door. So I went over and opened the door, and there was kind of this whoosh of wind, and this guy kind of came in, and I'm saying, "Are you okay?" And his face was red, and he was clearly kind of experiencing the weirdness of coming into the warmth from being outside. And it took him a moment to sort of settle, and then he said, I'm saying, "Are you okay?" Da, da, da. And he said, "Can you see me?" And I at first I was kind of disoriented. Like, of course I can see you. But then it made me start to think about that question in so many ways. And that's been sort of a driving question for me in journalism for my entire career. Can you see me? Can you really see me? Do you understand my experience? What is happening? And it sort of set me off on this path to really try to understand drugs, drug use, the human experience, mental health, the inside, outside of society, and all of those kinds of things, and start to focus on telling stories that would normalize every experience as opposed to sensationalizing or othering the experiences in the ways in which people were living. And his name was Terrence, and I followed him for a very long time. He kind of came and went. I haven't been able to find him for the last 7 years, but I go every month or so, and I go and try to find him and just walk and look. And for many, many years, we were able to connect and talk. And he's taught me so much about being decent, trying to be human in this endeavor that we call journalism. So grounding every question in the human part of it is something that has mattered to me in my work. And I'd love for Alex and for Moira to talk a little bit about the personal connection that you've had to covering these stories and where you find the challenges in that, and what are the ways that we might want to think about this together. So Alex, maybe I'll turn to you as somebody who spent the last couple of years really leaning in and trying to listen to people and their experiences.
Sure. Thank you for the question. Yeah, I have we started Crackdown a little more than 2 years ago, I think. And yeah, working on this project has been, I've experienced something that I had never experienced before as a journalist working on a story or reporting on anything, which is like a very clear sense of knowing sort of who my work is for and what it's supposed to do in the world, and having all that all be very clear. You know, before it's sort of like, you know, I've got this idea about like I want to report about the environment or whatever, and like, okay, I'll write up, I'll talk to all the people, I'll write about these policies, this stuff that's going on, what needs to happen or whatever. But it's sort of like this goes somewhere into the world. I don't know who reads it. I don't know what effect it has in it. But this is different. This is like, you know, our community is made up of the people that we're serving. We see these people all the time. We lose some of these people. In the 2 years that our show's running, we've lost two of the members of our editorial board, and I can't tell you how many times people in like regard how many times people have experienced loss as the show continues. Yeah, so I think that yeah, working on this project just taught me a lot about sort of the connection between community and journalism and your audience, and what it's doing in the world. And that's helped me a lot as a journalist in terms of focusing my energy. I don't know if I'm really getting the question. What do you think, Kathryn?
You are.
Okay, I'll turn it to Moira then.
That's such a good question, and I think it's really important for me when I'm approaching a story about thinking, for me, trusting community and building community, and I guess centering lived experience in my stories is really important. And it really starts, I think, with understanding like what is at stake and who has the most at stake when you're reporting. You know, I recently wrote a story about the issues and barriers that remain with opioid agonist treatment in British Columbia, specifically in Vancouver, which are numerous and awful. And you know what, I honestly did not talk to a lot of doctors or to the government very much, other than to get what I needed, because I felt it was most important to speak to the people whose lives were being affected, who were missing work, who were waiting for hours and hours at these clinics, who were not able to find healthcare for many years. And I think for me, that has really been a mindset shift, because in a lot of journalism, there's a focus on, okay, talk to the experts, talk like who's doing research on this, who's seeing patients, who's all these things. But, you know, drug users and are the experts in their own lives and in their own experience. And I've really made an effort to, I think, make a conscious shift towards a different understanding of expertise, and centering that expertise in my reporting. Yeah, I just, like, I don't have anything revelatory about how I connect with people or how I how I find sources, but I just think it's so important to show people also in what you write, not just in your interviews, and actually asking to talk to them, but showing people in how you craft a piece, how you contextualize their comments, how you, I guess, follow up afterwards and make sure that they're okay, or ask how they're going to be taking care of themselves like later that day. Show people that you value them and that you're going to them as an expert in their own experience, you know, with an understanding that telling their story, telling often the same story of years of mistreatment and like being ignored or being discriminated against or stigmatized, comes with like a really high price that talking to a like a physician might not, even though physicians have like deep wells of empathy and compassion much of the time. There's a toll that takes. So I do try to honor that toll and that expertise in my reporting. And you know, just on a personal note, I have a not a close family member, but a family member who I love, who you know, has been a substance user for many years, of criminalized substances, and that for me, like learning about that in their life as I've become an adult and connected with them beyond just through our parents and stuff, has been I think really important to understanding how I would want my cousin treated, or you know, how I would want my family member portrayed in a story, and the care that I would want someone to take with that story. And yeah, I do think of that every time I speak to someone.
It's incredible how grounding that is, to just be thinking about how would it be to be represented by someone. And I think that's one of the things that we try to do at the school, is to talk about the possible harms that can be caused by journalism. And when we start to put frames around people or represent them in particular ways, those ways might make sense to us, but do they make sense to the people who you're talking about, who you're writing about, who you're engaging with? So really kind of being aware of the power of the journalism that's being done. I just want to acknowledge this audience that we have. There's 40 some of you, and so many of you are going to work in this sector. So you're working and working with the science of drugs and drug policy, and these intersections between drugs policy, mental health, services, substances, all of those things. There's people with lived and living experiences in our audience. Got a couple of nice notes yesterday. Thank you so much. So good to be connecting with people who we've intersected with over the years. I really want to shout out Ann Livingston and Dean Wilson, who really, when I was a baby reporter, were kind of like, and another thing, constantly with me, and really taught me the power of the lived experience, and they're still at it. You know, Anne with her nursing and her activism background, Dean with his lived experience and his activism, just constantly participating in these conversations. So I know there's people in this call who have really done their part to try to reach out and support and help. So I want to acknowledge that. And for those of you who are working on the science side of the spectrum, journalists can't do their work without truth. And truth is sometimes hard to surface, especially when it lives in laboratories and in research forms. And unless people like you trust people like us to surface some of these findings and stories, they sometimes go unspoken and unsaid. So this is sort of a call, as people who work in journalism and really can't do our work without the trust of humans, all kinds of humans. This is really a call to all of you, as you have your own experiences, as you discover things, to please find journalists that you trust, you know, and reach out to them, engage in a conversation, and then maybe participate in the kinds of questions that they're asking as they go about doing their work. We could touch on so many different things. We could touch on stigma, how we talk about drugs and drug policy and so on. We could talk about the system. We could talk about the criminal justice system and its impact on people who use drugs. We could talk about the social determinants of health. We could talk about communities. So please let us know, maybe in the chat, because the time's going to go fast, what are the things that you would be most interested in hearing Moira and Alex talk about? And maybe we can sort of prioritize based on the list that we see where you want us to sort of center our conversation. Okay, so as we're waiting for the chat to start to fill, Alex, how do you contend with language? When you're out talking to people, that's one part of it. But when you're thinking about how to write, how to formulate questions, how do you contend with sometimes loaded language when it comes to representing people and the issues that you're covering?
I think our main guide for that is that we mirror what the community says. We don't like we're not 100% sticklers on never saying addict, never saying, you know, XYZ, because some people call themselves that and they want to introduce themselves that way. So we use the language that the community uses. And we do think a lot about the effect of the language that we use. And I'd say that one of the biggest safeguards there is one of our best editors for this is Lisa Hale, who's a member of our production team. She's also been a student of Kathryn's at the school, and she's an amazing producer and editor. She's always looking up for this kind of thing. And yeah, I don't know, I guess we used to do this more since the pandemic has thrown a big wrench in things, but we used to have more listening parties at Van Du where we would play sometimes early drafts of episodes for people at the meetings. There's like a Wednesday political education meeting at Van Du, and sometimes we would play our episodes there and have a little conversation with whoever's at the meeting. And that was super valuable to experience how people are reacting to our work in real time. We would often get comments and change things about the episodes and the scripts in that. And so yeah, like I think that just like we're trying to be a reflection of the community and represent them in the way that they are and would like to be represented. And so yeah, we're less sort of sticklers about this is the right way to use the language, and we try to mirror what people do.
I love that. What a great way to think about it, reflecting the community. If we were serious about doing that, that would make all kinds of difference in the way that people feel attached to the work and not subject to it. So, but that's probably why podcasts, the Crackdown is so beloved by people. They feel like it's theirs because their voices are centered. Wow. Okay.
Yeah, it's so sometimes if someone says to you, you know, I'm addicted to crack or whatever, and you say, oh, you're a crack user or something, it's kind of disrespectful to change whatever they're, you know. So we try and represent people as they want to be. Sorry, I'm just repeating myself.
No, that's good. Great. Moira. And I love the questions popping up in the comments in the chat, so I'll turn to those right away. And somebody private message, you're welcome to do that as well, to any of the three of us. By all means, if you want to send a direct message and you want us to address something that you're not comfortable surfacing here, please feel really welcome to do that. Moira.
Thanks. Yeah, I feel like Alex said a lot of the really important points. There are some really good resources from like BC CDC and other like drug user public health initiatives that kind of outline problematic language in the media. I know Canadian Press has a bit of an outdated style guide. So I think as a default, I defer to the community like driven guidance that's been developed. I'll find the link and try and put it in the chat. I just don't want to double tap. But so I default there. And then, yeah, when I'm interviewing someone, I always ask what language they like to use. I listen to what, you know, how they describe their experiences, what's important to them. And usually honestly, like the editorial process is also a little bit different. Like I'll usually share like, I'll usually share like, um, you know, a few paragraphs about how I'm summarizing their experience or how they came to have expertise and lived experience. And I'll email them and say, you know, how does this sound? And they're like, oh yeah, that's good. Or actually, I prefer this term. So it is a little bit more collaborative to make sure that I get the language right, even if that means using like addict in one part of the story or you know, person like heroin user in another part for someone else. It's important to me that that language is like individually very comfortable and their preference. And then also I'll just say like it's not only I think stigmatizing language that I'm really worried about when writing about this, but like vague loaded language from like government and other sources that I really try and keep a tab on. And it's hard, right? Because you're working fast and you know, it's easy to just pick the words that the government uses as like kind of the go-to boilerplate. But you know, when the government says like, oh, we're expanding treatment options or we're like doing safe supply or what, like the province has referred to the risk mitigation prescribing guidance from the BC CDC, which effectively expanded some prescription eligibility due to COVID. And it's not safe supply, it's prescription alternatives like Dilaudid and Cadian and stuff. They've referred to that as safe supply. So it's very important to like be mindful of what government like actually means, and or even saying like, oh, we're expanding treatment in response to the overdose crisis. Like not everyone who overdoses is is misusing substances or is addicted or isn't like needs any sort of like abstinence in their life to find like better outcomes. So you know, when treatment is like, what is treatment? Usually that's like residential treatment, and that's like also a whole other can of worms. So yeah, just being mindful of the kinds of responses I get and how they frame the problem and how they frame the solution, because that can be really loaded too and make a lot of assumptions about the people whose lives are being taken when in reality like it's, you know, everyone is at risk and it's not just habitual users or people who would be addicted or diagnosed with a substance use disorder.
Such an important point. And I was on a panel the other day, just moderating a panel, but they were speaking about access to opioids through the healthcare system. And it was just such a reminder of, you know, people originally often reach for opioids because of pain, which can look like trauma, can look like an accident, can be physical, can be psychological. There's so many different, so sort of understanding again, the complexity of this, and then thinking about the ways in which we interact with it, to really be honoring of and kind of real about the situation that each of the people that you're coming into contact with are contending with. So not everybody is a fan of harm reduction. Not everybody is a fan of treatment. Not everybody would want to interact with official sources of support. Some people just want to be able to navigate through some of this stuff on their own. So respecting their choice and their freedom to do so as well. So, okay, I'm going to turn to the chat. One of the first messages that I got directly was criminal justice. So maybe we'll come back to that because it's going to take some time to do. But let's go to Haley's question. What can we do when journalists are not speaking the truth? Thinking in Toronto around the coverage of the encampment clearings and attempting to hide the violence from the city. Great question. Alex, do you want to hit that one first?
I guess we often are at the show, our team is often frustrated, and it's part of why the idea for the show came about is the idea that drug users could express their own experiences, publicize their own experiences without the mediator of of a traditional journalist, someone who plays by the rules of traditional journalism, traditional sort of objectivity. So yeah, a kind of our response to seeing some of the narratives that would become popular is to put out our own counter narratives on our own thing. Yeah. Yeah, sometimes I don't know how to how to fix the rest of media, really, because from time to time I'll yell at someone on Twitter that does nothing, and everybody in the industry more or less plays pretty friendly with each other. It's a small world, um, and people don't like to fight each other that much. Um, so that's a tough one. I don't know. Garth, I know, like Garth will go on the radio a lot and debate others, and counter the narratives there, and he's really good at it. He's a great interview. If you're ever booking for radio, they have a rule at CBC, not too much Garth Mullins. But yeah, that's a tough one, because I don't know how to reform journalism, like, broadly. I don't know. Maybe Moira's got some ideas.
I don't know either. Maybe this panel is the beginning of our coup, though. Yeah, I think there are some really interesting mechanisms. I know the Toronto Star has like a public editor that you can complain to. CBC has that. I don't want to say that they're useless, because they clearly exist for a reason, but typically they will not defend everything that their outlet has done, but like they stick to kind of the rules of how journalism's been done in the past, and what's been considered fair. They're not super revolutionary in that sense, although they start interesting conversations often in their public responses. I would look for your allies in journalism, and not that journalists are perhaps on the side, but that journalists who are interested in reporting things as they are, and who have editors that will support that as well, and stand up for them. And they could really be at any outlet. I don't want to plug the Tyee, but I have a really wonderful supportive editor. There's lots of publications, lots of independent news publications across the country that have really good, I think, and really good coverage, and are doing journalism differently when it comes to homelessness and encampment specifically. So look for your allies, ask if you can talk to them, or just get to know them. See if you're interested in writing something yourself as kind of like a response. You're welcome to do that as well. I don't want to tell people that they have to make themselves vulnerable to like further spiritual if they write their own response, but sometimes I don't think people realize that it is possible to make a public response and find that audience with your concerns. So definitely explore those options. Otherwise, like, support the media that you see like doing good work. Like, email them, tell them why you like what they're doing. Toss them like $2 or $3 a month if you can afford it, or if that's something you're interested in supporting. And also like email the journalist. Usually it's often like an editor's fault too, so it's not just the journalist. But like, email the journalists and the producers that are responsible for stories that you like and for stories that you don't like. And tell them why, because I think if you're in journalism and you're too proud to like admit when you got a story wrong or when you framed something poorly, like, it's not the industry for you to be in. And so hopefully like the next time they will keep your comments in mind. And I've also seen like people straight up refuse to be, if you're in a position of advocacy where organizations go to, or news organizations go to you for interviews on topics, like I've seen people stop granting those interviews when coverage is poorly done. And I think that's a personal decision, but it can be powerful in sending a message that, you know, I don't want to be complicit or have my voice like used in coverage that I don't feel is like solutions oriented or compassionate.
These are all great ideas. I'll just note, Dallas has just written into the chat, effectively engaging media to share stories and reduce stigma, specifically around youth substance misuse. How can we convince media? It's a good question. I think some of the options that both Alex and Moira have just pointed out, I'd say if you see journalism that is not reflecting an experience that you understand, or the truth of the matter, that as you know it, question it, find folks you trust, who do work. Don't feel like you have to answer any media inquiry just because they're knocking on your door does not mean you have to respond. You've got all kinds of agencies, so find people that you trust. And then to echo both the points that Alex and Moira have made, let your voice be heard. If something's going on, reach either for a platform or for a person and say, hey, this is what I know to be going on here. Can we have a conversation? And most journalists worth their salt will listen. If they're not listening, that's a good clue. Just hang up and move on. If you don't have a person out there who's listening to you, let it go, I would offer. Christina, how can all of us promote this way to approach media coverage as a normative approach? Alex, Moira, anything you wanted to add to your comments about sort of this relationship, this engagement, this deep listening, and then trying to reflect people back? Anything you would want to add to that to address Christina's note?
Maybe, Christina, if you're listening, you could clarify a little bit. Normative in the sense that
like what I was thinking was like, how can we make this the way that all these topics are always approached? So, you know, the two of you and maybe a few others are doing it in this client-centered, person-centered approach. You're using the language that the individuals want. You know, you're looking at the individual as an expert and not the hospitals or the doctors. And that's not normal. That's not what we see. Like, I'm in Ottawa, and our safe consumption sites, everyone, it was not in my backyard was what everyone was saying. But the thing is they'd been running for years in their backyard, but there wasn't all these issues they thought were going to arise. But it's because media displayed it as being this horrible thing where you're going to find needles in the parks and you're going to find needles in your yard. And so, like, how do we get it to be more normative, where it's go down and talk to the individuals that are accessing those services, give real information and stats based on the real things that are happening in these sites and at the shelters, or speak with social workers, like that kind of stuff.
Yeah, I do think that journalists do respond to feedback and to public pressure. So I think if it becomes the expectation that in stories about drug users that someone who uses drugs be consulted or quoted or talked to, and audiences sort of react when that doesn't happen or demand it, I think that could have an effect.
The other thing I might offer here is that seeing the media as a block makes it seem like this intimidating, huge force. It's just a bunch of people working for different companies, collecting different kinds of paychecks. So starting to see people as individuals who might be able to have a conversation with you to change representation. I know the situation in Ottawa and in Toronto, the impressions would suggest that the only way people are talking about these things is in an unsophisticated, this is the way it is. But actually, there's all kinds of alternative media There's all kinds of dialogue and discourse happening on public radio waves, on certain private chat shows. Some television reporters, John Woodward, who used to be at CTV in Vancouver, he's now in Toronto. He's having really sophisticated conversations. So finding people whose work you like and putting your energy into them might also be a way to kind of counter this. Because you're right, Christina, it can feel like this overwhelming, oh my God, wall of stuff, but to sort of try to not see it as a block and really look for these individual people who might be able to make the change. Moira, anything you want to add here? And then I'll keep moving through the chat.
Yeah, no, I just to echo exactly what you and Alex said, and not add much more, but I think this is undoubtedly something that media as a whole like has to get better at, is like understanding the crisis and different intersecting issues and reporting on it better. So like find the people who are like, my dedicated beat allows me to like really learn about it, and I think stay on top of like new developments in a way that supports like more compassionate coverage. But like frankly, other newsrooms just do not give their reporters the resources and the time to do that, and that's really unfortunate. So while we continue to like push on making sure everyone who's covering this like understands and like is working from like a good base of knowledge and destigmatization, like find your allies, because I think there are people doing really, really wonderful work.
I'll just tag on there that if you are in a position where you're being asked to comment by media, you might be able to suggest or connect or facilitate a connection with someone with lived experience or someone who may be in a position to know better than you. Though I'll also say that can be a fraught process, and you have to be very careful about exposing people to media without, if they're not ready, or preparing them for what that could be like and the risks of that. So yeah, it's I think people can kind of be that link in the chain.
I see a note here from Amanda that is a really, really interesting question. I'm interested, they write, in the difference between centering lived experiences / expertise versus sensationalizing, exploiting folks with lived experience. So it's right in the zone that we're talking about now. How do you find those lines? How transparent are the two of you when you're talking to people about what this experience is actually all about and how their voice may or may not be used in the stories that you're telling? Who wants to go first? Maybe Moira?
Sure. Yeah, I can go first. Thanks, Kathryn. It is a really fine line, and for me, I think it comes down to like, why am I going to this person, or why do I want to talk to someone with lived experience? Like, is it just to like check a box on the story and write about like this government announcement, blah blah blah, and then just say like, this person who was a former heroin user like says this, blah 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 blah, like it would have really helped them, and then kind of that's it? Or am I trying to build a relationship? Am I trying to gain a deeper understanding of what's going on, rather than just populate a story that I've already decided what it's going to say with a character? And that's not to say it's not important to talk to people, have personal experience in many stories, but I think when you're kind of shoehorning someone's life into an announcement about, new treatment beds or harm reduction or another overdose prevention site, you can really miss like the nuance, and they can feel either misrepresented or like even re-traumatized if the interview is really intense and really difficult for them to recount, and then you use like one line that's not really even about like the meat and potatoes of what they told you, to like kind of illustrate something that someone else already said. So I think just keeping in mind like whether their story is guiding the coverage or the story is guiding what they say, like, and you're kind of shoehorning it in. And yeah, it's hard because sometimes you do have just like a government announcement that you need to cover and you want to include like some good perspective, but that's usually when I go to someone who's like an advocate and really versed in like policy issues and they can speak directly to the policy. I wouldn't necessarily ask someone to like fill me their life story for 30 minutes or an hour and then have it in like a 400-word story. That's not trust building. So yeah, for me, it's about like intention and how the story really shapes coverage, the person's story that they tell me shapes coverage and not the reverse.
Alex, do you want to build on that at all?
Yeah, it's a difficult thing because yeah, often like journalistic work can maybe, I don't know if it's unavoidably or inherently maybe it's inherently extractive in the way that, you're out there collecting the experiences of people to do your job and to like make your product. And I think the thing that makes it, that addresses that like exploitative dynamic is first like sort of being aware of it and acknowledging it and being aware of like, so what do they get in return? Why, it's valuing their time, valuing their point of view. Like, are you going to stay in touch with this person? Are you going to listen to them? Are you going to listen to their concerns about your coverage? Or are you going to go the extra effort to make sure that that what's appearing in print is going to be, not harmful and okay with them? And it's a tough balance because you're balancing, especially if you work at a more traditional media organization like CBC, you're balancing what your editor expects and what your host expects and all this stuff. But I think the key thing is that it's not to treat people as a relationship where they're disposable, where you throw them away after you're done with them. It's like, like knowing it's maintaining a relationship, I think.
Yeah, so important. Moira just used the word reciprocal in the chat. And that is something. It's not going in and taking somebody's story and speaking for them. It's speaking with them and sort of having a conversation about how they're going to be represented in a respectful way. So it all comes back to that piece around trust. And then again, we'll double back to language. So a bunch of people are in the chat asking about how we talk about treatment. And treatment is such a spectrum, but it tends to be sort of buttonholed into residential treatment, people waiting for treatment, and not being clear about what's being discussed. So context, for the two of you who are out there telling stories, how do you make sure that you're building in context to the stories that you tell so that you're not sort of using a single word to capture and risk sort of becoming a cliche or a stereotype of something and not being clear about what the truth of the matter is. So when you have something as complex as treatment, how do you address it so that the people who are listening understand it and that the people who are discussing it internally in your stories see themselves in their own experience? Moira, maybe I'll come to you on this one first, because I know that this has been a challenge.
Yeah, first I just want to start by saying there was a great comment in the chat. I'm just trying to remember who said it. But anyways, treatment is a spectrum, and harm reduction is treatment, and I don't mean to say, and same with residential treatment or abstinence-based programs. And I don't mean to say that as in like treatment is like quote unquote the holy grail of what someone can find who's using substances, because frankly, like for a lot of people, like improving their life is about decriminalizing and regulating drugs. It's not necessarily like stopping using drugs. Like the harms come from the system that criminalizes them and that yeah, kind of medicalizes the responses to them. So yeah, I do think when we're talking about treatment and we're talking about like what that means or why that's touted as kind of a solution to the crisis, I think frankly it misses the point. Maybe we talk a little bit too much about treatment because what we have really is like a poisoned, unpredictable drug supply that no one, like I also think the term overdose is really not effective anymore because it's almost impossible to take a dose knowing what's in it unless you test it these days because of how volatile the drug supply is. So, you know, I think, I don't know if I'm exactly answering the question, but I think when we center treatment as a solution or like a really big part of the issue, and it is, we maybe miss the point of like all of the things we could do that are not medicalized, that are not like making people feel as if they failed, if they like don't quote unquote complete a treatment program, or they don't stick to it, or they aren't able to access one. And one more point, I know we're wrapping up soon, but this is so wonderful to be at a conference that's engaging like healthcare professionals and practitioners and researchers. I do think though, the more I speak to drug users and to activists and advocates and people doing like community-based research, like the more I realize how important the push for like non-medicalized options is. And that's not to say that medical options can't be really helpful for people, but I think the more we can decenter prescribers as gatekeepers to a lot of treatment options, like the more we can really build like strong communities where drug users are like supported in all aspects of their lives and can find community that is like stigma free and find solutions that don't require them to like prove how bad their substance use is affecting their lives. So not to knock the hard work all of you do at all. I just think it's important to hold that with the limitations of a lot of professions as well.
One of the comments in the chat is saying, thanks, Haley, for this. What can we do to help journalists as a worker in the field or community member? So first, the implied belief that there is still some goodness in journalism, which is so appreciated. I mean, right now we know that people tell us again and again that they don't trust institutions and they don't trust journalism as an entity. So finding ways to trust individual journalists is going to be so important in this work. So what can we do to help journalists? So Alex, I'll turn to you and then to Moira, and then I might have some thoughts on this as well.
Well, what helps is how can we help journalists? I mean, I know that, I mean, the thing is like so many people in your position already do so much to help journalists. You know, spend a lot of free time explaining what's going on, what you see, introducing, connecting us to different people. Yeah, I don't know, like, I don't know, maybe Moira, do you have something to say? Maybe you'll spark some thoughts for me.
Yeah, if they're true that people like everyone in this panel do a lot already to help us, and I don't want to make suggestions that like do our jobs for us, because it's also on the journalists to seek out like new perspectives and new information. But like, please tell us what's going on. Please tell us what's fishy. Please tell us like what is really concerning you, or what's been missed, or what we did badly. Yeah, like it's like some of the most important stories I've reported, and I think this emergency requires a lot more like investigative journalism to like really uncover what's going on. Like those stories come from people with the know, like raising the alarm on what's happening. So like please reach out to a journalist you feel comfortable with, send them like unmarked mail, on Signal, whatever. And if you feel comfortable, like talk to them about what you're seeing and what's concerning you, because yeah, if like the mechanisms of like the response, especially in government and healthcare, can be like black boxes with freedom of information access. So we really need, like I rely heavily on my sources to talk to me about like what they're seeing and what really needs to be investigated, or even just where to look.
I just want to just echo what my colleagues have just said, and also acknowledge all of the people who have come forward over the years. The number of brown envelopes, phone calls, invitations down to see and witness people's experiences, letters that people write, sometimes anonymously, sometimes not, and have done so over the years to be able to surface some of these stories. I just got one the other day from a young woman who had been incarcerated for 12 years. She's out, she's been working, staying in a halfway house. She breached her parole conditions the other night because she used. This is a person who's been using for 25 years. And the parole officer has recommended that she not come out again. And that the way to deal with her is not to provide support so that she can kind of carry on with all the productive things that she's been doing, but to throw her back in prison to see out the rest of her sentence. So there's something that's just off, and to be able to question that, but to be able to have this two-way dialogue. So for all of you, as you do your work and as you see things, find journalists that you trust. And let them know what's happening, not in a way to expose yourself to harm or to jeopardize the trust that you have with the people that you work with, but to really have relationships of respect that will help the truth to come out so that the system can change to better support people who need the system to change, because it's not working. Too many people are dying. Too many of these stories have been told again and again and again, and they don't seem to be getting traction. Every once in a while, there's glimmers of hope. We've got now a new minister of mental health and addiction services in British Columbia. There's all kinds of zeros behind numbers and programs. But until the system actually changes to meet the needs of people, we're still going to be sort of having this endless loop. So all of you can participate in ways to make that change. And leaving the last word to Moira and to Alex, if there's one thing you could do to address this crisis, this public health crisis that is underway, what would be the one thing that each of you would suggest people do to make the change? Alex, I can guess where you'd go with this one, and you too, Moira. So whoever wants to go first.
I guess I would say that I think I want to say that we can't look to journalism to save the day, I think. And like the idea that first we need to change how we look at the drug user, see them as a human, as someone deserving of respect and dignity. And then that will change the system. I don't know if it's necessarily going to happen in that order, or if it's the system that makes us see drug users as less than human, people less than deserving of dignity, and not able to determine the course of their own lives. So, there's probably a bit of one and the other happening at the same time that's going to be required, but many of you are embedded in organizations where you have some sort of influence on what's going on, whether you're, you know, a member of like the College of Physicians, or you're an employee of PHS or whatever. I would say look within your own organizations and look where you can organize with people within your own, or your own organizations and communities, and what you can change within. You know, because the system, I don't think journalism is going to change the system, you know. I don't know. Yeah.
Moira?
Yeah, I agree with Alex. Not to deny the power of storytelling and changing minds, but I really do, or you know, educating people, growing understanding, to hopefully change minds. But I do think that the real change happens when those, you know, educated, changed minds start demanding things change and start, right, like making the status quo like not acceptable, which I think because drug use is seen as something that's like really in the shadows, it could never happen to me, could never be in my family, it's all in the, you know, in the downtown east side, or people who, like, you know, they made a choice to live like that, they could stop anytime, you know, all of these misconceptions, we're able, like, frankly, like the government is just able to like not act as if it's an emergency because enough people see it as something that won't affect them. And sooner or later, it's going to affect everyone in DC, whether you know it or not. And so I don't want it to get to that point. I want people to demand change and to vote for change, and to organize for change before it gets to the point where everyone in the province knows someone who's died or has themselves passed away. But yeah, I really do think it's about organizing, and journalism can play a role in amplifying and building understanding.
Yeah, journalism is really a reflection of society. And as all of you are out there doing your daily work to make the change, we can do our work if we're able to access and reflect the things that you're out there doing. So huge gratitude to Alex and to Moira. I just so admire the work that you're doing. It does make a difference. One mind at a time, one conversation at a time, one opportunity to build trust does go a ways. Thank you all for hanging in with us. It's amazing to see 3 full screens of humans. Even though we can't see you, we know you're there. So we thank you so much, and wish you the very best as the conference continues. And if you want to be in touch, the Tyee is where you'll find Moira, and you'll find Alex at the Crackdown podcast, and both of them are on Twitter, so you can follow them and see their excellent work there as well. Thank you for taking the time for us, and I wish